Rates of COVID-19 disease here on Navajo Nation are among the highest in the country. Children have been orphaned because of this virus. Elders have been lost. I'm Dr. Laura Hammitt. I'm the director of the Infectious Disease Prevention Programs at the Johns Hopkins Bloomberg School of Public Health Center for American Indian Health. This center has been working in partnership with the tribal communities for over 30 years. Navajo Nation spans 17 million acres across New Mexico, Utah, and Arizona. There are 13 grocery stores for a population of over 200,000 people on a landmass that's the size of West Virginia. There are many small, overcrowded, multi-generational households. There are high rates of poverty, and all of these things have contributed to the high burden of disease with the COVID-19 pandemic. This has touched nearly every family in some way, and these collective tragedies have really brought the community together to do everything possible to slow the spread of the virus. Tuba City had very high rates of test positivity, over 40%. And so we recently hosted testing blitzes in the Tuba City area to make testing more accessible and to help us be able to identify and isolate cases. At the last blitz that we did, over 500 people lined up in cars, some of whom waited for more than 2 hours to get their testing done. Until we have a highly effective vaccine or therapeutic, contact tracing is really the main tool that we have for containing the spread of this virus.
This is Sharday Pyochi with the Johns Hopkins Contact Tracing Team.
The Johns Hopkins Bloomberg School of Public Health Center for American Indian Health is helping to develop a robust contact tracing system and training contact tracers.
So I just wanted to give you a call about your COVID-19 test results.
We must isolate cases, we must trace and quarantine contacts, and we must provide support for households that are under isolation and quarantine so that they can stay at home. Employees of the Center for American Indian Health have been providing wellness boxes to families to have that direct relief capacity.
Our ancestors' prayers are still protecting us today. We feel that strength within. We all have an innate responsibility to each other and to our community, and I feel like that is what keeps us going.
We're so excited to be partnering with CORE to help scale up home support services. It's incredibly important to actually give people the tools they need to comply with recommendations for quarantine and isolation. World Central Kitchen has been a huge partner in our response efforts here on Navajo Nation. They came and hired up a large staff of local employees and trained them on how to receive and repackage food supplies to be delivered to their communities.
There's never been a question about whether or not these communities will overcome this threat. It's just a matter of when and how quickly.
Kind of heavy about it.
I think the relationship that our center has with Navajo Nation has really put us in a position to be able to use our resources to help.
Water, hand sanitizer, toothpaste. We just try to give people what we have.
The Bloomberg School has a long-standing focus on social justice and health equity, and I think that that's been an important part of this response. Native Americans have been invisible in terms of their health inequities for a long time, but there is an amazing resilience and strength in these communities. And it is my hope that this pandemic will serve as a call to action to fulfill unfulfilled promises, to adequately fund education, healthcare, public health infrastructure for tribal communities in the United States.